from Gandhi Medical College. My topic is serological evaluation of acute febrile illness for leptospirosis and scrub typhus in patients seronegative for dengue and chikungunya antibodies. Coming to introduction, in tropical countries, acute febrile illness is mainly caused by viruses such as dengue and chikungunya and bacteria such as leptospirosis and scrub typhus. Leptospirosis is caused by gram-negative bacterium Leptospira intravens, which is a zoonotic and waterborne disease which is transmitted by direct or indirect exposure to urine of rodents. Leptospirosis presents as non-specific febrile symptoms in majority of cases, while in 20% it presents as a classical Weins disease. In the year 2020, 4,872 cases of leptospirosis were reported by IDSP, Ministry of Health and Family Welfare, India. Coming to scrub typhus, it is caused by gram-negative bacteria Orientia susugamushi, which is transmitted by bite of larval trombiculid mite. India is an integral part of susugamushi epidemiological triangle. Scrub typhus, similar to leptospirosis, it also presents as a non-specific febrile symptoms resembling dengue and chikungunya fever. While HR is a specific symptom, but it is present only in 1.3% of the cases. Therefore, the confusion between early symptoms can contribute to delayed diagnosis of leptospirosis and scrub typhus cases, which leads to higher mortality rates. Therefore, my aim is to estimate the proportion of leptospirosis and scrub typhus cases among acute febrile illness which are seronegative for dengue and chikungunya antibodies. My study period is from January 2019 to March 2020. My inclusion criteria: among patients with acute febrile illness of duration 5 to 15 days, samples which are negative for dengue and chikungunya IgM antibodies were included in the study. Exclusion criteria: serum samples with equivocal results, insufficient samples and insufficient data. Coming to methods, all serum samples included in the study were tested for leptospira using pan-bio leptospira IgM ELISA and scrub typhus using scrub typhus detect IgM ELISA as per manufacturer's instructions. Coming to results, a total of 368 serum samples which are seronegative for dengue and chikungunya antibodies were included in the study. Out of those 368 serum samples, 59 are seropositives. In those, 2.99% of cases contribute to leptospirosis, while scrub typhus was contributed to 13.04%, while 0.54% are co-infections. Pathogen could not be identified in 83.96% of cases. Coming to age-wise distribution of leptospirosis and scrub typhus cases, majority of them are in the age group 20 to 44 years. Coming to gender-wise distribution, there is no significant gender differences for both leptospirosis and scrub typhus. Coming to seasonal trends, majority of cases are between July 2019 to October 2019, while peak was in August 2019. Coming to discussion, prevalence of leptospirosis in dengue suspected cases. In my study, it is around 3%, while in other studies, it is between 1.04% to 19%. Coming to prevalence of scrub typhus, in my study, it was 13.04%, while in other studies, it ranges between 13.7% to 39%. Co-infection with leptospirosis and scrub typhus, in my study, it was 0.54%, while in other studies, it ranges between 0.1% to 25%. Coming to conclusion, etiological diagnosis was achieved in 16.03% of cases. In that, leptospirosis contribute to nearly 3% and scrub typhus 13%. Dengue and chikungunya are the viral diseases and no specific treatment is required for them, while leptospirosis and scrub typhus are the bacterial infections and specific antibiotic is effective in treatment. And also, leptospirosis and scrub typhus are underdiagnosed due to high burden of dengue and chikungunya. Therefore, leptospirosis and scrub typhus should be included in routine screening of acute febrile illness for early diagnosis and prompt treatment. These are my